Thanks for coming back for our final SAFE class lesson, using 911. We'll begin by watching a short video about a 911 call center near Chicago. The call centers in Heron and Marion are almost exactly the same. The dispatchers will answer your call, ask a series of questions, give you instructions, and send help to wherever it is needed.
911, what's the address of your emergency?
When you dial 911, you set into motion a lot of people. Depending on your emergency, 1 to 100 trained personnel are ready to respond. And the better the information you provide, the better prepared emergency responders will be to help you. Hi, I'm Colleen Koboleski of the Oak Park Fire Department. When you call 911, you are immediately connected to a dispatcher at the West Suburban Consolidated Dispatch Center. They service Oak Park, River Forest, and Elmwood Park.
All right, I'm sending the paramedics to help you now. Just stay on the line and I'll tell you exactly what to do next, okay?
First, they will ask you 4 basic questions. Where help is needed, what has happened, when did it occur, and who is involved. Once those basics have been obtained, your operator instantaneously relays that same exact information by computer to their partner,
Attention, Oak Park Station 1, Station 3.
who immediately puts the call out to the police and/or fire department.
Call for the ambulance at 735 Clarence, 735 Clarence for the 65-year-old male who's having chest pain.
Okay, Oak Park Station 1 for ambulance 612 and engine company 603.
At this point, your dispatcher will continue to ask you questions.
Is he allergic to aspirin or ever had a bad reaction to it before?
The reason is because they need to. All the questions being asked are very important. Now don't worry, the responders are not going to be delayed because of these questions. While you have been on the phone receiving instructions from the dispatcher, responders have already been sent. Now depending on your emergency, just the ambulance might show up or an ambulance and a fire engine as well. The reason is that if you are having a complex medical emergency such as chest pain, shortness of breath, someone not breathing, or life-threatening injury, the paramedics on the ambulance will need more help from the crew on the fire engine. The members on the fire engine are paramedics as well. So you are receiving the highest level of care possible for you or your loved one. Now that help has arrived, they are going to start assessing the situation and start treating the patient with the appropriate medical care. When the patient is stable enough to be moved, the crew will bring the patient out to the ambulance. Some people wonder why the ambulance will still sit there. That is because we still have to call the hospital and finish the patient's treatment if necessary. We will always try to get you to the hospital you would like to go to within reason. But if you are unstable, you will automatically go to the closest appropriate hospital. If you are ever in doubt about when to call 911, it is better to call and be safe rather than sorry. We would much rather get there and see that there is nothing serious going on than not be there when something is.
You can call a 7-digit number, but that phone may not be answered. In a true emergency, always call 911. The call taker will ask you 4 very important questions. Where is the emergency? What is happening? When did the emergency occur? And who is involved? Describe what is wrong and what kind of help you need. Is the emergency happening right now, or did it happen sometime before? Who needs help? And what can you tell the dispatcher about the persons that's sick or injured? The call taker will ask more questions based upon the emergency, whether it's a police call, an ambulance call, or a fire. The dispatcher may give you instructions including how to provide first aid for someone who is sick or injured, or other instructions depending on the type of emergency. If you're calling for an ambulance, the dispatcher might have you check to see if the person is breathing. They may tell you how to stop bleeding if the person is injured, or they'll give you instructions on how to help a person who is choking, or even how to do CPR. For police calls, they might ask you to describe the people involved, describe any cars involved, or maybe give you instructions to find a safe place until help arrives. If you're calling for a fire, the dispatcher will make sure you get out and stay out, but they'll ask you questions about the fire and ask you if anyone else is trapped inside. When you call 911, the dispatcher screen will show a map with a marker that tells them your approximate location. If you call from a home or a business phone, The dispatcher's computer can give them the exact address, but sometimes this is not always right. Your cell phone won't give an exact address, only a GPS location. It's pretty close, but it's not your exact address. It's important to always know the location of where you're at or the address where you live. If you're not sure, you can find mail in the house, which will show an address, or you can use landmarks like stores, churches, restaurants, or other familiar places to give directions to where you are. It's important to have your house numbers clear and visible, especially at night. Responders may have a difficult time finding you if they can't see or can't find your house number. Even though we have computer mapping, if your house number isn't visible, it can slow us down and delay getting you the help that you need.